Well, good morning, everyone. We will be continuing our poster presentation sessions here at 9 o'clock. Our next speaker is Rachel Simmons, and she's going to be talking on the topic of autism and the gut microbiome. So I think, microbiome, excuse me. So I think that sounds like a fabulous presentation for this morning. So Rachel, I am going to stop my screen share and turn it over to you.
Great. All right, so the title of my project was Autism and the Gut Microbiome. So the abstract, I decided to do this literature review over autism and the gut microbiome. I used several databases to compile 21 articles discussing the gut microbiome and its effects on autism-related behaviors and the gut-brain axis. There were 7 themes identified in this paper discussing environmental factors which contribute to the development of autism and GI abnormalities. Right. So autism is a developmental disability defined by diagnostic criteria that include deficits in social communication and social interaction and the presence of restrictive and repetitive behaviors, repetitive patterns of behaviors, interests, or activities that can persist throughout life, and is characterized by a lack of social interaction and verbal and nonverbal communication within the first 3 years of life. So these children often have GI problems such as frequent diarrhea and stomach cramping, and this has been found to be caused by a difference in the GI microbiota makeup. And it has been theorized that this alteration also affects how the brain works via the gut-brain axis. This has sparked many questions on how autism-related behaviors can be treated other than through pharmacotherapy. The reason I chose to do a literature review on autism and the gut-brain axis is because autism is very common, especially among boys, and rates of diagnosis are increasing. This increase may not be due to an increase in incidence, but greater ability to recognize the disorder and diagnose it as autism. Autism is generally diagnosed very young, between ages 1 and 3, which is an important time for development of the immune system and the microbiome in the gut. I also wanted to learn about GI disturbances and food sensitivities, which can cause nutritional deficiencies in these children, because my first degree is in nutrition, and that interests me. Okay. So the prominent database I used was Google Scholar. This had the most relevant and recent information on autism and the gut microbiota because it's not a very commonly researched topic. Autism and the gut microbiome yielded the most favorable results for this topic, though there were still not many randomized control trials studying the presence and treatment of an altered microbiome in children with autism. And I made sure all the filters I used were full text, English, and within the past 6 years due to an ongoing research in this topic. And then most of these terms came out with fewer than 75,000 results and low level of evidence. So of the articles reviewed, there were 7 common themes: roles of the diet, food sensitivity, pregnancy and childbirth, breastfeeding, probiotics, fecal transplantation, and autoimmunity in the development and treatment of autism. This is the results of my literature review. As you can see, Google Scholar had by far the most results, especially with autism and diagnosis. My formatting is a little weird. Okay. So my results and discussion. In the differences in the gut microbiome of neuroatypical children, children with autism were found to have a vastly different gut microbial makeup than neurotypical children, which may contribute to GI symptomology and autism-related behaviors. These children were more likely to have high levels of Clostridium and decreased levels of bacillus, and these affect the creation of oligosaccharides and other such nutrients within the gut. The role of food sensitivity in autism. Children with autism are more likely to have food sensitivities and aversions related to an increased awareness of textures and tastes. This may lead to nutritional deficiencies in children with autism and also a poor fiber intake, which can exacerbate the GI symptoms that they already experience due to the microbial makeup. And these children are much more likely to have aversions to colorful foods such as fruits and vegetables, which are also high in fiber and nutrients. So this affects their intake greatly. The role of birth and breastfeeding in autism. Childbirth has is a great factor in whether or not children will develop autism. Children born via cesarean section who did not receive swabs of the mother's vaginal, fecal, and heme microbes were much more likely to develop autism or autistic traits than those born vaginally. Children who were not breastfed or did not receive colostrum were also more likely to develop these symptoms, as essential microbes which populate the GI are found in breast milk. I found this to be the most interesting aspect in my literature review, and it's definitely important, but also difficult to create any interventions for, as most C-sections are not elective. The role of probiotics in fecal transplantation in autism. Fecal transplantation is just now starting to become practice in patients with C. diff and is not very well studied in the treatment of autism. So in one study, bovine colostrum product was administered to infants as a probiotic, and it contains essential microbes found in the gut of neurotypical children who, whether or not breastfed, generally have these microbes. The study found the administration of this product to produce a microbial makeup similar to the makeup found in neurotypical children. Another study found children who were treated with antibiotics and given human fecal microbiota in capsule form generated a gut microbiome makeup similar to that of neurotypical children, which begs the question, should children who are given antibiotics early on in life for ear infections or strep throat, should they be given human fecal microbiota in capsule form? And then this also brings the question of whether fecal transplantation could be a possible treatment for GI symptoms and autism-related behaviors in these children. The role of autoimmunity in autism. Children with autism are more likely to develop a compromised immune system, which can lead to lesions and inflammation within the GI, increasing the incidence of GI symptoms such as diarrhea and cramping. And this has also been found to increase the severity of autism-like behaviors. And children with autism are, interestingly enough, more likely to develop autoimmune diseases, especially psoriasis and food allergies, further increasing the likelihood of nutritional deficiencies. So it's an important aspect to take into account. So the nursing implications for this, the role of the nurse in adolescence with these patients is family support and treatment and education on things such as fecal transplantation, because that can seem weird or scary to parents, even though it's just a capsule form, and education on that is important. And then also education on dealing with autism-like behaviors and possible disruptive behaviors and possible other treatments for these other than pharmacotherapy. Limitations for this literature review. The main limitation for this project that came up was the lack of randomized control trials in studying the gut microbial makeup in children with autism and possible treatments. And this makes sense as doing studies with children can be extremely difficult. And interventions such as probiotic administration or fecal administration can be difficult to find volunteers for, especially when you're targeting parents. But these do need to become researched or be researched more before they can become evidence-based practice and possible treatments for these individuals. So in conclusion, increasing awareness of the gut-brain axis and possible treatments for autism-related behavior could bring about more research and trials and studies. Children with autism have been found to have a vastly different gut microbe colonies, and this could lead to an increased severity in both GI exacerbation and autism-related behaviors. There are many factors to consider in treating these children and spreading awareness that may open new research opportunities on alternative treatments for autism and the gut-brain axis and possible prevention of future autism-like behaviors. So my references are available upon request because I had 21 of them, and that is my contact information. Does anyone have any questions?
Yeah, Rachel, Dr. Jessica Hale, boy, do I remember your topic from early on, especially since I'm interested in physiologic birth. Actually, the C-section on demand is up to 8% right now, which means there's no physiologic reason for the mother. So I'm thinking if we could at least reach those 8% and say, think about this, ladies and gentlemen. We're doing better with breastfeeding, but I don't think we're doing so well with this cesarean. So the C-section rate's over 40% in some areas.
Yeah, possible interventions for this, although it's still relatively not very well studied, is doing a swab of the woman's vaginal canal and inserting it into the infant's mouth in an attempt to get that, that bacteria into the infant. But I'm unsure of how effective this has been so far, as it's not extremely well studied in terms of autism yet.
I have a question. This is Joe Carter, Rachel. Really interesting presentation. My question is, and you may have answered it, but I didn't catch it. When you say that children are usually recognized between 2 and 3 years of age or something like that, is that correct? And
yeah.
So it's hard for me to parcel out cart or horse. Is it the diet, a nutritional trigger that happens before diagnosis? Or is it a pattern that's noticed at, the gut microbiome, or is this a pattern that's found at birth? Because they probably aren't going to check into it until after the diagnosis. You know what I mean? So it's hard to know whether a nutritional, exposure is creating this problem, or whether there's something that's integral to the genetics of that person. Do you know what I'm trying to ask? I mean,
are you asking, like, do you think the development occurs due to nutrition before the diagnosis, such as breastfeeding or access to the mother's vaginal microbes?
Well, I guess, I guess we can assume that the child picks up gut microbiome either from formulas, but kids are eating things, before age 2, right?
Mm-hmm.
So, it's just, and also when we talk about cesarean section rate, even though only 8% did Dr. Jessica Hale say are related to good reasons to have a C-section? Is that what she just said?
No, I said there's 8% of mothers that demand a C-section without any medical reason.
Oh, okay.
Yeah.
It's just really, really hard to sift through all of these factors in a meaningful way. And you can't, it would be very difficult to do a randomized controlled trial and to really figure out what's the etiology really of all of this. But there's so many things to consider. Anyway, I'm just rambling on. It's hard for me to sift what comes first in all of this. What's really causing all of it,
I think your point's very well taken, Dr. Carter, in that until they're able to do really large cohort studies that are long in its longitudinal aspects, it's really difficult to know, like apple and or cart and horse kind of outcomes out of the studies. That yes, we can identify that children who are diagnosed with autism have altered microbiomes, but we don't know if they were present at the time of birth. We only know they're present sometime after diagnosis occurs. And so it is a very difficult problem. I mean, if we could do some of those large studies, then you could say, for an infant who is born by C-section, we should administer X, or for the baby who is bottle fed instead of breastfed, we should administer X to try and prevent autism. But we don't have that kind of data yet to make those correlations. And I will say from my personal experience with school age and adolescent children, that a lot of them, probably the vast majority, have some degree of food sensitivities and altered food intake and preferences. So that could be, have extended back, to a year or a year of age, where you start to introduce foods that they start to exhibit some of those altered food preferences.
I think I also
go ahead.
have an answer to that. We're kind of just now learning that infants aren't necessarily born with a sterile gut. And so I don't believe I think it's assumed that autism and immune, just like the diseases start to develop when, not from birth, but when it's starting to become apparent that that infant does not have those microbes. And then this starts affecting the immune system. I don't think it is what the child, when they are diagnosed, is eating. I think it begins when the microbiome is not sufficiently populated.
So, Rachel, are you saying that the gut microbiome begins through the birth canal with exposure of gulping amniotic fluid, so they don't gulp amniotic fluid before they go through the birth canal and that sort of thing? And I was truly thinking prenatally, what does that mean for women? And
yeah, I think I'm not super well versed on the during pregnancy, mostly just the childbirth, but Dr. Jessica Hill, let me know if I'm incorrect on this, but I think we are learning that when infants are born, their guts are not as sterile as we once believed. And so it's possible that they are having bacterial swapping between the mom and infant before birth. But I think it's still being studied extensively.
So, Rachel, this is Dr. Jessica Hale again. This is really fascinating to me, especially with the increase in autism and the increase of operative births and Pitocin induction. I think that one of the things that your little study and what we're beginning to find out is that physiologic birth is physiologic for a really good reason, and we need to quit messing with Mother Nature. So all of those people who are refusing to immunize their children and think that's the reason for autism probably ought to have a look at some of the gut biome things. So What are you planning to do with this information when you graduate? Are you planning to continue this? Because it's very interesting, I think, and it's a very good prenatal kind of a thing to do with parents.
Yeah, I would like to become a DNP and possibly do research on this, even though it is difficult to attain this, the right to do this research because it's children and pregnant women are a vulnerable population. But I do think it would be, I'm not sure if I want to do more of the prenatal and birth aspect of it or the nutrition in these children and possible, so working with their food sensitivities and aversions, and then also look more at fecal transplantation and probiotics in these individuals and how that affects their autism-like behaviors and also their GI disturbances, because these children do have a lot of problems with diarrhea and gut cramping, and that obviously isn't going to help children who are having behavioral disturbances.
Rachel, it's Gail Fike. I've been following along with you as your chair of this project, and it's been very interesting to me. We just, didn't have as much time as I would have liked to talk more about it. But as a mother of a child with mild Asperger's, I'm very interested in it. And it took me years and years to kind of pull his Asperger's story together because they're very complicated kids and you don't have one provider that has enough time to pull it together. So the parents kind of have to do the research. And he was preemie and he was not breastfed because of his complications at birth. And it just makes me wonder, how things might have turned out differently had he been a normal birth and breastfed, and maybe his immunity would be better because, as you know, he's had all these infections in his teenage years. So very interested in your project as we've gone along with it.
And kids with autism are still obviously a blessing, but it affects them too, just as much as their parents. So focusing on treatments for their behaviors and their GI disturbances it's important for the medical community and the nursing community.
It's really interesting to me too. Really, really interesting.
Yeah.
And off the topic of your project, you mentioned that you were interested in pursuing your DNP, but I might suggest that if you're really interested in research, you might want to look at pursuing your PhD instead, because the PhD is really a research-focused doctorate, whereas your DNP is more a clinical, so looking at process improvements and that kind of thing. And so if you're really interested in true research, you may want to think about the PhD route instead.
I was going to say the same thing, Rachel. I think knowing you, that might be a better route for you.
And you know what? I was going to say that too, but I'm glad my colleagues beat me to it.
I was actually told that in my entrance interview. So I'll have to.
Well, I can see that it would lend, all of these factors would lend to such an interesting, really large scale case control study. And I would think you'd have really motivated participants, in it, that kind of thing. It'd be really an interesting thing to study.
Yeah.
Any other questions from anybody? Hearing none, I just want to say, Rachel, that it was a very interesting presentation. I personally enjoyed it quite a bit. It gives, incentive to go out and read more, which is, I think, always a great thing about poster presentations, whether or not they motivate you to then go home and, do more reading on your own. And I think you certainly hit that mark today. So very good, very happy for you. And we will congratulate you and then close up the session. and get ready for our 9:30 presentation. So
Thank you
Thanks
very
so much.
Good job,
Rachel.
much. Thanks, guys.
Good job.